Okay, this is Pierre. Pierre came to see me about a year ago with severe back pain and depression from that. Actually, depression many factors, and is not responding to conventional treatment. So tell us how you get to come to see me.
Yes, I came to see Dr. Tong because of the lower back pain and the depression and also constipation due to the side effects of the antidepressants. And back pain because I had back injury 2005. They didn't treat me properly, and I never pay attention, and I had a condition for a long time. But basically I came here because the pain was excruciating, incapacitating, and my life was over. And also my psychiatrist who treated me for depression, she told me to take ECTs or transcranial electrical stimulation because all the antidepressants I had been taking, and any antidepressant that she was going to give it to me is going to be constipated. So that was a sentence for me.
So did you take the ECT?
So I took the ECTs. Yeah, I went through ECTs without any result. Very traumatic, and they had to give you anesthesia, put you under anesthesia, and I didn't see any improvement. And then the other.
Do you get worse? Do you get the ECT get any better or no change?
No change.
Because I know people with ECT get really sick afterwards. Drain your energy and stuff like this.
Very suicidal, no energy, and thinking about the doctors were giving the back to me, sending me home to die. They didn't know what to do because I have intolerance to antidepressants. So the only option for me was coming to see a doctor.
How about transcranial stimulation? What were you going to do?
Transcranial stimulation was offered to me at St. Joseph, but no insurance pays for that. You have to pay out your package $4,000 for one section. I think it's just a joke because
it is a joke. Yeah.
It's a joke. How can you pay $4,000 for if
and there's no
guarantee.
No studies that shows that's that effective.
Yeah.
$4,000.
My psychiatrist
one session, yeah.
Just left me at the end of the rope. I say, oh my God, my life is over. Lower back pain, constipation, depression, and I cannot take antidepressants because I get more constipated, more bloated.
Did the antidepressant help you or no?
The antidepressants, they all help for a certain amount of time. I have been dealing with depression for more than 30 years. They help me for a certain amount of time, and then they stop working, and then they give me constipation, bloodiness, and I got to the point that I had bowel obstructions, severe bowel obstructions, and the doctors they do it. Then I don't have a colon. I had a colonectomy in 2004, colonectomy.
Bowel obstruction from the antidepressants?
Yes, the antidepressants slowed my bowels to the point that they had to remove my bowels. I was having colonic inertia. Then they removed my bowels, and then after they did the surgery, remove my bowels, I got the constipation back, and also the depression. So it was a vicious cycle. Depression, antidepressants, constipation, and more depressed because I was constipated. So
Pretty soon you don't have any bowels to be removed. They cannot keep removing your bowels. They cannot keep doing the colectomy.
They did the colectomy, but still, only for 4 years I was feeling better. But then after 4 years, the symptoms came back, and I had to be on a special diet, and my depression and my stress contribute to bowel obstruction. So I had suffering bowel obstructions until I had the surgery. So for me, it's not easy. Life is very easy, not easy for me. It's very difficult and very tough because I'm depressed. I have to take antidepressants. Antidepressants give me constipation, bloodiness, and bowel obstructions.
So how did you find out about me? Yeah.
So I was listening to a radio on Saturday afternoon, and I was so discouraged when I heard Dr. Tong in his program at 7:40, and somebody he was interviewing some patients.
So you came to see me, and
who had
tell us the result.
Oh my gosh, I came to see Dr. Tong. The first 3 treatments, I was much better. No, the depression was lifted up almost completely. I had more energy. My bowels started working.
So after the first treatment?
After the first treatment.
How about your pain? How much your pain was relieved?
The pain was relieved. No 100%, but 80%. Because only the 3 first sessions, you have to come back for maintenance acupuncture, and I made a mistake during the summer.
So wait, after the first treatment, your pain was much better, 80% better, and your depression was much better?
Much better.
And you did not need to take antidepressant?
No, I started taking antidepressants because I feel more energy. And
your bowel movement's good?
And the bowel movement's better, no bloodiness, and I say, my gosh, this is the alternative. How come I never thought I was
so you were not depressed?
And then popping pills to laxatives, and then popping for pain medication. My life was miserable, just popping pills all day. I don't want to live like that.
So after my treatment, you were not depressed, even from the first one?
For the first time, I wasn't depressed. I went back to my routine. I had more energy. I feel like more hope than before. When those doctors sent me to ECTs, I thought that was the end of my life. But for the first time, I feel a hope with Dr. Tong, because he really knows exactly what's going on. He is very wise. He has been studying for several years about these conditions, and my problems are functional, and most of my problems are functional due to the blockage of energy. And I recognize I'm a very stressful person.
So after I treat you for a while, you got talked into doing surgery, and tell us about that.
Oh yes, I made a mistake. After I was doing much better with my back and depression and constipation, my primary care physician, I went for a checkup, and he said about my back pain, and I answered him. It was still there, and sometimes when I sit down for long hours, the pain was back. And he recommended me to go to see a surgeon.
They did a special surgery.
They did such a special surgery. They put me through the diagnosis, MRIs, and...
Actually, your family doctor, you told me, said he did not believe in acupuncture, and then Medicare might give you a problem. And that's what scared you into accepting this surgery, which caused...
yeah, my primary care physician, he's very skeptic about the acupuncture, oriental medicine, and he sent me to see a regular surgeon, orthopedics. And of course, the orthopedics, they were there, and very...
the surgery cost $30,000, Medicare $30,000.
Very nice guy and everything, and they pushed me to go on the surgery in April 2014. I didn't go. I failed to show up. So then called me at home and say, if you don't come in May or June, we are not gonna operate you. And I say, oh my God, these doctors are maybe they think I need the surgery. So I went there, and they...
You tell me that they have meetings, give you free dinner at the hotel to promote the surgery.
Oh yes, after I went for the surgery and after they put me in the hospital and everything, when I went for the surgery because he sold me the idea that I have a side joint condition. The side joint is, and they are having now treatment which is SI bone implants. They are 3 titanium plates, and they can place it with minimum invasive surgery. He did told me the surgery about having SI joint surgery and the implants, and he told me you're gonna recover in 6 weeks because I was worried. I am very active person and very functional, and he said 6 weeks. I asked him before, of course, the pre-ops and everything. I asked him, doctor, how long is it gonna take for me to recover? He said 6 weeks. So I bought the idea. I just went.
So what happened after the surgery?
I underwent surgery. After the surgery, I was in more pain, worse and incapacitating pain, the worst I ever had. During the time I was in the hospital, it wasn't that bad because they were popping me Tylenol 3, Norcos, and even a pump with medication. And they know that I am very constipated. They cannot give me painkillers, but they kept popping painkillers.
How long were you in the hospital?
I was in the hospital for a week, and then I went to a rehabilitation hospital for 1 month. The pain was worse. I didn't want
never get relief.
Never get relief. Got worse. And the incision, they made me incision in the area. They say minimal invasive surgery, and this is full invasive surgery. They got all my hip through the hip, and they did the procedure through the hip, and they did.
So how disabling were the hip, were the pain?
Oh my gosh! During the time I stayed in the hospital 6 weeks of misery. I had to learn how to walk. I had to learn how to put my clothes on. I couldn't take a shower. I was completely, I was crippled. I thought, my gosh, these people, they didn't fix me. They got me crippled completely, and I was in the wheelchair and the walking. And even though I had nurses assisting me, it was so much. It was very painful, even to go to the restroom or even to minimal activity, physical activity.
Okay, here's a point, okay? That American surgeons, American doctors promote drugs and promotes a lot of surgery. And after surgery, the patient gets so disabled. The pain was worse. And it's $30,000. And Pierre was telling me that they have meeting in the hotel, expensive hotels, and give you dinner, free lunch, okay, to promote this. And you got 30,000, 10 people, is 300,000. But the patient get worse in the hospital and afterwards nursing homes, and you don't ever get better. So how long did you suffer? When was the surgery last time?
The surgery was on August the 6th, and ever since I've been more incapacitated.
August 6th of a year ago?
This year.
Oh, this year?
2014.
August,
3 months.
September, okay. September, October, November, now it's October.
October, see,
yes.
3 months.
3 months.
It has been 3 months, but I haven't felt any better. I feel like it was a big mistake. I should do more research, and I should come to Dr. Tong.
So you came back to see me. What happened with my first treatment when you came back?
Yeah, it has been 3 months after I had the surgery. I went to see my orthopedic doctor a month ago, and he told I was in pain and swollen incision side, very swollen.
So what do you say?
Very painful, and he said everything is normal. That's a tissue paper, a tissue swollen, and I showed him. My incision had a bump, and it was very painful, and it was getting swollen. And I showed it to him, and he took X-rays on me, and he showed me only the implants. The implants are in place, but on the incision side, he told me that I had to live with that. That was a scar tissue, but I don't feel like that scar tissue was going to
Well, here's a point.
hurt that much.
Your doctor really don't care about whether you have pain or not. See, right now, if you tell, or go ahead, tell what happened with my first treatment when you came back.
Oh my gosh, I had to came back to Dr. Tong because he's the only doctor who has treated
So
me.
what happened?
Well, and he got away with the pain before, so my last hope was Dr. Tong. I say, if he doesn't do, these people are gonna let me die, and I'm gonna be in a wheelchair and a cripple. I came here last week. Last
week, okay.
Last week.
What happened with treatment?
Last week, yes.
So today's second treatment. What
I
happened with the
was
first one?
so crippled, I could not dress up myself. I was very incapacitated, and I told the doctor I went through and then went through surgery. The surgery, I guess they did worse on me.
Okay, so
they
what
didn't
happened?
do any good on me, the surgery. It was a mistake.
So what happened with my treatment?
Oh, I was in such a pain. The incision side was so swollen, and there was a lot of painful area in the muscles and everything. So he applied the injections, and he exactly went to the trigger point.
So what happened after?
Inject those trigger points.
After my treatment, how do you feel?
Oh my gosh, the incision side was completely flat. It was a bump full of fluids, and I guess in blood and hemorrhage or something, because I felt the incision side very painful. After he applied the shots, it was gone. I felt like it was.
It got flattened. The swelling was down.
The
How about the
swelling
pain?
was going down until it disappeared. The incision side was perfect. I was very surprised, and I had such a relief. I said, "Oh my gosh, it can't be. This is like I can't believe this is amazing."
Today, okay, today is second treatment. Today I treated you for the tailbone. So
Okay.
tell us about how much pain you have right now.
Oh, I don't have any pain right now. I can't.
So you have no pain right now?
For the tailbone, because the incision side is perfect. I also amazed.
They spend $30,000 for surgery that make her worse. A whole month in the hospital, 6 weeks in the hospital, and then nursing homes and all these expenses. Okay, 1 and 2 treatment, the pain is totally gone, and that's exactly why we have this healthcare problem. Doctors, if you go tell your primary care doctor what I did for you, I'll guarantee you, he doesn't care. You still think acupuncture is no good. Okay? He will not go to my website and check it out. Because this is my experience with all the people. They go back and rave how much better my treatment is. The Western doctors simply do not care about anything that make patients this much improvement. All they want is to promote more drugs, more surgery, and more money. And as long as people don't know about this, we'll continue to waste money. You'll bankrupt our system.
It is true. I agree with the doctor, because when I went to see my orthopedic doctor, and after the surgery, he was advertising that kind of procedure and inviting people to the hotels, free lunch. Like advertising,
the same thing like drug company give doctors free lunch. In one expensive restaurant, you have 3 drug company giving free lunches to all the doctors. Doctor get the lunch, get the money, and so forth. They'll promote their drugs. Okay, and now they're promoting surgery that they have never been scientifically tested. And instead, okay, now the patient get much worse. They look at the X-ray. The X-ray look perfect. But the patient feel lousy, suicidal, painful, and they don't care.
Yes,
okay?
I went to
They say
you
know everything on surgery working fine, and it's your problem.
Yeah, he told me when I came back to see him with the pain, and then
I
told him that
go back and talk to write this up and tell your primary care doctor and your surgeon, and see what their reactions is. I guarantee you, they don't care. They will not even look at it. Anyway, so you go ahead and write it up, and we'll give you a follow-up report on what their reaction is. Okay?
Yes, after they got you and after they sell the stupid procedure and you and the surgery, they don't follow up, they don't answer phones, and they send you to the pain management doctor to keep in the cycle, taking medication.
Did you go to the pain management doctor?
I had to go after.
So did they help you?
No.
So it's just a waste of money, okay?
That's a waste of money.
Vicious cycle. Drug surgery.
I went back to the same pain management, and he is giving me Norco and medication that
more
I can't
same thing that didn't work for you.
More same thing that isn't working.
Good. Let's go back. You go back and tell your doctor what happened and see what the reaction is, and then we'll report a follow-up interview. Okay? Thank you very much.
Thank you, Dr. Tong. You are amazing. You are such a wisdom. You are such a wise man.